Now turning to the latest on the coronavirus concerns here, Governor Raimondo's daily briefing on the state's response is going to be at 2:30 today. That's a change from the norm. Normally these are about 1 p.m. or so we want to let you know about that change to 2:30. Here are some of the top headlines of the day. Lifespan, Rhode Island's largest hospital group, confirming some of its employees have tested positive for COVID-19. Spokesperson saying in a statement a small percentage of the state's 124 cases are Lifespan employees, but it's not clear exactly where they work or how they were exposed. All of them are recovering at home. And we also learned that a state employee at Eleanor Slater Hospital in Cranston tested positive. That person, along with 4 others, quarantined along with about 25 patients. Meanwhile, President Trump wants the country back up and running, he says, by Easter, which is Sunday, April the 12th. He said he'll make a decision about relaxing nationwide social distancing guidelines by the end of the federally mandated 15-day period, which is March 30th. Federal health officials are urging caution, though, suggesting that advisories could be relaxed in some areas of the country not affected by widespread infection. Now, the U.S. Senate reaching an agreement on the third phase of that $2 trillion relief bill for businesses and American workers who've been sidelined because of the virus. This will provide billions in loans for big business and grants and loans for small businesses. It also includes a one-time cash payment for most working Americans. News of the deal sending the world market surging overnight. Still not clear exactly how much money each state will receive from this deal. However, we've learned money has already been making its way into Rhode Island. And reporter Brandon Truitt is live at the State House. So, Brandon, we already have some cash on hand, apparently?
Yeah, Danielle, that's exactly right. And listen, they'll take every dollar they can get at this point because this virus really having widespread economic impacts on nearly every portion of the state budget, from the medical industry to food programs, even those businesses that have been crippled by closures. So at the beginning of the month, the CDC informed Rhode Island that they would be getting about $500,000. That helped the state get the operation to fight this virus up and running. But days later, the president signed the first round of relief passed by Congress. It sent nearly $5 million this way. That money primarily used for medical response. But in mid-March, a bill passed to help people put food on the table, Rhode Island receiving over $1 million to provide meals for elderly residents. Now, as helpful as all that money is, it pales in comparison to the $2 trillion relief package agreed to overnight.
We have a bipartisan agreement on the largest rescue package in American history.
It's good news for the doctors and nurses in emergency rooms around the country who are waiting for more masks and more funding. It's good news for families all across America.
So the Senate still has to vote on this. That's expected to happen possibly by this morning. It will then move to the House, where it's expected to pass. The president could sign it by today. That package also includes that cash on hand option. Maybe you've heard a lot about that. I'm breaking that down for you in about 30 minutes over on Fox Providence. We're live in Providence. Brandon Truitt, Eyewitness News.